Hi, my name is Dr. Julio Novoa. I'm a practicing OBGYN and cosmetic surgeon in El Paso, Texas. Today I wanted to talk about something that came up just a little while ago related to why did I not include board certification as one of the questions that you should ask when deciding on an OBGYN. Last year I came out with the 12 top questions to ask, and uh, and this came up recently that why didn't you include board certification in those questions? Well, unfortunately, I think I have a very good answer, although my board certified colleagues will not agree with me or be upset by what I have to say. But it has specifically to do with the fact that being board certified in no way improves the overall benefits to a mother who's trying to hire an OBGYN, since the board certification does not in any way police or monitor doctors who have an incredibly high rate of cesarean section. And what I mean by that is that the major problem we have in obstetrics right now is the very high rate of cesarean section. We're looking at a 33% chance that any woman who becomes pregnant is going to end up with a cesarean section, despite the fact that we have seen no improvement in this incredibly high rate of cesarean section as compared to the 1970s. When I was a baby, born in 1967, the rate of cesarean section was approximately 5%. Now, when I'm 45, the rate of the cesarean section is approximately 33%. And yet, we have not seen an improvement in the overall benefits to the mother or to the baby with having such an incredibly high rate of cesarean section. So, what does this have to do with board certification? You have to remember a few important points. Most of the doctors that practice in obstetrics and gynecology are board certified OBGYNs. And yet, greater than 90%, in my opinion, greater than 90% of these same board certified OBGYNs are the ones that are responsible for the incredibly high rate of cesarean section. And the other 10% are either retiring or have a conscientious objection to getting board certified, or are in residencies or are still in training and have not yet reached their board certification points of decision making on whether or not they're going to be board certified. So, with the majority of doctors that are actually practicing obstetrics responsible for the incredibly high rate of cesarean section, I really do not feel that board certification in any way is helping us make a decision on whether or not your doctor, the one you're going to choose, being boarded or not boarded, is going to help you in any way make a decision. As a matter of fact, it may, in a lot of ways, make it more difficult or kind of confuse the situation greatly. Why? Why is that? Well, although most people think that board certification is extremely important, you have to understand that all board certification really represents is the fact that you took an exam and you passed it and you presented a series of documents showing how many cases you did, and it was accepted by the board. However, the board does not regulate, does not police, does not monitor its doctors on how they practice once they enter into private practice. So that means that once you become board certified, you can basically practice any way you want to practice with very little or no monitoring from the board, the American Board of Obstetrics and Gynecology. So this is why you have such an enormous fluctuation of cesarean sections as compared to doctors that are still in their residencies that have to prove themselves as compared to doctors that are already in private practice that no longer have to prove themselves and are no longer monitored by anyone. I believe that what the American Board of Obstetrics and Gynecology has to do is it has to step up to the plate and it has to start monitoring its doctors better. Because to represent yourself with a board certification means that you're supposed to, in a lot of ways, a lot of patients think that you are a very highly qualified doctor, and you may be a very highly qualified doctor. But if you don't practice in that way, who is to benefit from this? All it is a token diploma without any backing or any support. And this is what we're seeing happening out there in the public eye. What we're seeing is that women are ending up with cesarean sections when they shouldn't need to have a cesarean section from board certified OBGYNs that are not practicing the guidelines that the board itself required you to practice in order to pass the board certification, and yet the board is not doing anything or not able to do much related to controlling the rate of cesarean section. So I don't believe that asking the question about whether or not you're board certified is the appropriate question to ask. As a matter of fact, I am not board certified and I refuse to be board certified because I don't believe in what is happening. It really represents anything that I want to be associated with. I don't want to be board certified if 90% of my colleagues are not practicing the way that they were taught when they were in the residency. I don't want to be board certified if they don't have a legitimate explanation as to why we have a 33% cesarean section rate. I don't want to be board certified until the board and the American Academy, the American Congress of Obstetrics and Gynecology do more to protect the women of the United States against unnecessary cesarean sections, where we're looking at a 500,000 cesarean sections are estimated to be done in the United States, which are unnecessary as compared to all of them that are being done. 500,000, 500,000 cesarean sections may be done unnecessarily. And these are being done, but the majority of them being done by board certified OBGYNs. So how do we fix the problem? Well, first of all, we simply ask the American Congress of Obstetrics and Gynecology and the American Board of Obstetrics and Gynecology to go ahead and start monitoring their doctors. That the doctors have to show their log list. They have to show that they're working within the percentages that is recommended, 15% cesarean section rate, primary cesarean section rate. And this is where we're looking at how do you do that? You post your statistics. I post my statistics. Every month you can see how many deliveries I've done, how many vaginal deliveries I've done, how many cesarean section I've done. Overall, you can see exactly what the numbers are. And every month I go and I determine how many complications that I've had, and is this similar or better than the complication rates of doctors that have rates of cesarean section higher than mine. This is an attempt to make sure that I'm doing everything that I can for the benefit of my patients as well as the benefit of their children, as well as I consider the babies to be my patients as well, up until the time that the pediatrician takes care of them. So I think the solution to the problem and the 13th question should be, what are your statistics? Dr. Novoa, Dr. X, Dr. Y, Dr. Z. What are your statistics? Just like they talk about buying a new used car, show me the Carfax. Dr. Novoa, show me your OB stats. When we start showing or having to show our obstetrical statistics, you're going to see that the rate of cesarean section is going to significantly decrease for the benefit of everyone, the benefit of the patients, the benefit of the babies, the benefit of the healthcare system, the benefit of our society. And until that happens, board certification is not a question that's important or is of any relevance to managing the obstetrical care of a patient. This is my opinion. I'm more than willing to listen to anybody else's opinion, so they feel free to comment. And that's my answer to why I'm not boarded and why I don't believe that board certification should be a question that's asked of the 12 original questions. Thank you very much.